Morning, everyone. Thank you for coming. Just give you a few seconds to come in. Welcome to today's session for Social Work Week 2024. Today's session is all about how shared lives can ease pressures on hospital discharge. So thank you very much for being here today. My name's Carla. I'm the Communications and Engagement Manager for PSS, and I'll be facilitating a conversation this morning with two experts in shared lives. We have social worker and registered manager Bob Bell with us, who's worked in shared lives for well over 20 years. And we've also got shared lives carer of 10 years here with us today, Paul Crilly. So between now and 11, we'll be filling you in on shared lives, how it can be applied practically in a hospital setting. And we'll also be hearing from the real life experience of the people who are doing the likes of Paul and other shared lives carers. Just going to admit a few more people in as we're starting. Thank you for joining, everybody. As I say, today we will be talking about shared lives and how it can be applied in a hospital discharge setting. If you've given shared lives a bit of a Google in the last few days, if you wanted to know a little bit more about it before coming to today's session, you might have seen that it has recently received a big push in funding from the Department of Health and Social Care, around £20 million, to expand its services over the next few years or so. So now is the perfect time to be learning more about shared lives, because if it isn't already being implemented in your region, then it's likely that you'll start seeing it pop up over the next few months or so as well. A couple of notices before we get into it. So there will be no Q&A today. Shared lives is an incredibly flexible form of care, and there's so much to talk about shared lives as well. So we're going to cram all of that into 30 minutes for you. But we will make sure that we signpost you to all of the right places to find more information following today's session. And just to let you know, today's session is also being recorded. So a little bit about PSS. So PSS, we were born and bred in Liverpool right off the back of the First World War in 1919. And since then, we have created a lot of services that you probably know about today. Essentially, we're a social enterprise that supports people to live happy, healthy, and hopeful lives. Our shared life services have expanded from Liverpool in the last 45 years since we actually invented the model of care. So today you can see us in Merseyside, but also Greater Manchester, North Yorkshire, Staffordshire, Lincolnshire, Norfolk, Suffolk, and North Wales. So if you are based in any of those local authorities today, if you didn't already know, there is a shared life service being delivered by PSS in that region at the moment. So a little bit more about shared lives. Shared lives was, as I say, was invented by PSS back in 1978. So it's actually been nearly 46 years this year in the making. We like to think of it as a little bit like fostering, but only in the sense that shared lives carers, just like foster carers, share their home, they share their daily life, even their favourite spot on the couch with the people that they're supporting. Essentially, it's about giving adults, anyone aged over the age of 18, who have support needs, with the chance to help them live their most independent life. So whether those support needs are temporary or permanent. It's also an incredibly cost-effective form of care as well. If we compare it to supported living or residential care home settings, it can save up to £8,000 to £30,000 a year per person in comparison to those settings. Obviously, that depends on the level of care that the person needs at the time. But if we look at it in terms of a hospital setting, shared lives cost around £96 per day to provide support to somebody. As you'll all probably know, a standard bed in a hospital per day is at around £350. We do also say it is the most personalised form of care you can get. It's incredibly supportive, it's in the community, and it has the person's strengths and aspirations really at the core of what they want. There are now 9,000 carers across the UK delivering shared life support, and that is across 150 different providers. So PSS by no means is the only provider of shared lives. We are the largest and longest running network of shared lives carers, but there are lots of different providers out there as well. So everything that you'll hear from Bob and Paul today is how PSS does it. The other 150 providers might have slightly different ways of how they implement it, but essentially it's quite similar across the boards. And CQC in the pandemic rated it the best and safest form of care. So I'm going to hand over to Bob now, who's going to give you a really practical overview of how it can be applied. Over to you, Bob.
Thanks, Carla, and good morning, everyone. We thought it might be useful just to explore some of the different types of shared life services that we can provide. As on the list there, the living arrangements, these are sort of the typical shared lives arrangements, and these are for people who've got assessed support needs and require accommodation as well. These are usually on a long-term basis, so the person would be assessed and they would go to live in a shared lives home for no set period of time. The intermediate arrangements are very similar to the living arrangements, but these might be specifically for set periods of time or flexible periods of time. This could be so the person could learn independent living skills. It could be that their main carer, their main family carer has gone into hospital or for whatever reason can't provide that support. So the person would go in, live with the shared lives carer for a set period of time. Family short breaks, and this is for people who live with their own families and either they or their family carer would need a break. So they would go and stay with the shared lives carer for a period of time. That can be for a night, a couple of nights, a week, or whatever. This would usually be assessed by a local authority social worker, and the family would get a set number of allocated nights. Home from hospital, I'm going to talk about that later, so if we just leave that to the end. So as you see there on the list is domestic abuse and domestic violence service. This was a pilot project that PSS were part of, and it was a local government initiative to see whether shared lives could support people who are fleeing domestic abuse or domestic violence. And PSS provided that service. We were very, very successful. We supported 11 women during that period to hopefully be able to move on to better lives. The PSS team actually won an award for that. But unfortunately and sadly, there's no longer any funding for that, but the project did prove that there is a need for that and it works. Shared lives can also provide emergency arrangements and has done in the past, but obviously we have to take into account the level of support that person would need and also that it's just an ordinary family environment. Also, we would have to take in any specific adaptations or accommodation needs as well. So to move on together arrangements, or you probably know these better as transition arrangements. And this is where a young person who's going to be turning 18 is living in a foster arrangement and will still require support into adulthood. So this would be that they would stay with the foster carer, but the foster carer would then have to go through the approval process as a shared lives carer, and that would be the move on together arrangements. Move on arrangements, very similar for young people just turning 18. Maybe they're living in a foster arrangement but don't want to stay with the foster carer, so they would move on to a shared lives arrangement, very similar to the living arrangements. So home from hospital. So how can shared lives home from hospital use discharge presses? Home from hospital, PSS had done home from hospital over the years, but it was only when we got together with a Liverpool commissioner, and at that stage, the bed blocking or delayed discharge was quite difficult. So what we did is we went out and we met with hospital social work teams, medical staff, and basically explain what shared lives was. The whole point of Home from Hospital is that people who are ready for discharge, who would normally be discharged to home if they were living with a family member, and this could be if they needed monitoring with medication, it might be that there was concerns over falling if people had joint surgery, or it could be that they were waiting for the care package to be in place. So it's people who require sort of low-level support and the support that would normally be provided by a family member. But the concern would be that if they were discharged to their own property, then there might be risks. The Home from Hospital shared life service, it support people to manage their condition. So as I said before, that might be meant to make sure they're taking the medication. It might be to ensure that they're doing exercises that physios have requested they do. Yeah, we understand and apply the person ongoing social care needs, so we would do a full assessment prior to that person moving into a shared lives arrangement. And we feel it's a better way that people can find their independence again than actually going into sort of like a care home or residential home or staying in hospital. And as it says there, reduce the need to seek unwanted residential, because lots of people who are discharged into residential don't really need that. They just need that level of support to make sure they can get back on their feet. And as it says there, helps people get back to the day-to-day life quicker. Okay. This is Kim Johnson, who's currently a Labour MP. She was also a social worker in Liverpool. And as it says there, she was assessing someone who was having problems with alcohol dependency, and he was having the revolving door syndrome, where he was going into hospital, he was getting better, he was coming out, and then he was going back in again. But you'll hear a little bit more about Kim a bit later. So what are some of the other benefits of shared lives? It's a very person-centered service. Our support would be working with the carers to provide the level of support that person needed. They would be involved in that, so they'd identify what level of support they would need. It's connected, so it would be the shared life service, the carer and the person, and also the local authority would work together to ensure the positive outcomes for that person. It's safe. As Carla said before, CQC rated shared lives the safest form of support during the pandemic. The advantage of shared lives is that people are being monitored on a daily basis, but also in an ordinary family environment. It's not a clinical environment, it's not a nursing environment, which we feel is a lot more comfortable and better for people. It's adaptable and innovative, so what we would do, we'd have a matching process, so we would meet that person prior to them going to a shared lives arrangement, just to see what level of support they need and any particular things they like, because obviously living in a family home, we might have to take into account whether people are allergic or don't like dogs or cats and that sort of thing. So we would take all that into account. And as Carla said previously, it's a very, very cost-effective service in terms of people staying in a shared lives arrangement. It's basically initially a reablement service, and it usually lasts about 6 weeks. So if you can think about how much that would cost the NHS to keep someone in hospital for 6 weeks, and the comparative costs it would be to have that person staying in a shared lives environment rather than taking up bed space in a hospital. Okay, just some of the things to take into account for people using Home from Hospital. It's not a nursing service. As I said before, it's about the level of support that can be provided. If that was an ordinary family member, all the carers are trained professional carers, but they're not legally allowed to provide nursing care. So if people did need ongoing nursing care, that would have to be provided by, for example, district nurses, that sort of thing. It doesn't exclude people from shared lives, but the shared lives carers wouldn't be able to do any nursing service. As it says there, as I said, the shared lives care provide the support ordinary family members would provide. 6-week period. As I said before, it can extend beyond 6 weeks, but it depends how long that person would take to recover. But on average, it's around about 6 weeks. With home from hospital, we can react very quickly. So what we would do, we get a referral, we go and meet that person in hospital, we'd explain what shared lives is, how long that would take, how long they could stay in shared lives, and hopefully we can move that on quite quickly, and we have done. We've placed people within 24 hours, and as I said before, if it's low level of support needs people require, we can usually find a carer or match a carer with that person. Okay, so who are our carers? Shared lives carers are trained, approved, and they're professional carers, even though they are providing that support in their own homes. To become a shared lives carer, it's a very, very robust assessment process. It can take up to 3 months. There is a panel process people have to go through, very similar to fostering. Shared lives carers have to have satisfactory DBSs, references, and there is formal training. Carers have to do an awful lot of training and update their training as well. We also have experts by experience as part of the recruitment process, and those experts by experience are either, you know, they can be people who use the service, or they can be other carers as well. Health and safety checks, we make sure that the accommodation being offered meets, you know, a safety standard. So we would do our own health and safety checks on the property. The shared life services would monitor all the arrangements as well. So it's not just a question of people going to live with carers. They would be monitored by the shared life scheme to make sure the level of support that is needed is being provided. Carers can come from all backgrounds. They don't have to have a background in health and social care. We've got taxi drivers, we've got lorry drivers, we've got other people who then train to be shared lives carers. As I said before, the recruitment and process is quite robust, and the training is there for them as well. So as I said, different skills, experience and lifestyles. And we've got various homes and family settings. We've got people in terraced houses, people in shared lives carers in terraced houses, shared lives carers in very, very posh houses. We've got shared lives carers living on farms. So when people say to me, what can you describe what shared lives is, it's very difficult, but it's just ordinary family living. But they are living on being supported by professional carers. So we have a matching process, and this is where when we have someone who requires support, and as I say, in home from hospital, that would be we'd go in to meet the person, assess what level of support they need, and then what we would do is we would match that level of support required with maybe the skills, knowledge, and experience of the carer, and we might have to take into account, as I said before, some accommodation needs as well. We have got a Matching Lives website that people can access in PSS, and that's where carer profiles are put on there. But we still have to go through the matching process to do that. So some of the myth busters about shared lives. I've done lots of awareness sessions with people, and some of the things that people think about shared lives are not actually true. Some people think shared lives is a lifelong service. So when people go into shared lives, it's forever. And as I said before, we have intermediate shared life services, so people can be there for a month, a year, 2 years, whatever. So it's not a lifelong service. The aim of shared lives is to enable people to become as independent as they can be. And if that means they move on, then that's the best for them. Shared lives is only for people with a learning disability. It isn't. In terms of home from hospital, people don't have to have additional support needs. All they need is to be that level of support or monitoring that's required. Similar to shared lives, only people with learning disability. Shared lives is just for older people. It isn't. As I said, it covers all different client groups from 16, and there's no upper age limit. And people's benefits will be taken off them. In terms of the living arrangements, there is an element where people have to pay for daily living costs, but in home from hospital they don't. And shared life service is a 24-hour service. I don't know anyone who can do a job for 24 hours a day, but shared lives carers have a good go at it. But then they are responsible for providing that support for 24 hours, but obviously can't be expected to be able to provide that support. So people will get daycare in sort of the other arrangements, the shared, the living arrangements or intermediate arrangements. Okay. So to make a referral, this is just in PSS, you can make a referral in many ways. You can pick the phone up and phone us, or you can in Liverpool they have an egress system. You might have similar systems in different regions as well. And as I said before, specifically around home from hospital, we would go out and meet the person in hospital, and hopefully with the hospital social worker as well. With home from hospital, we tend to do this as a more quicker process, and we identify possibly a carer. Introductions are made if possible. Sometimes we have the carer going into the hospital to meet the person rather than the other way around, because of just sort of issues. And then we have an agreement and funding is finalised, and then the person would move into a shared lives arrangement. But there is an ongoing process for that as well, and we would be monitoring it. For that 6-week period, we would probably do a lot more monitoring that we would normally do in sort of like the long-term living arrangements. Okay.
Thank you very much, Bob. Shared lives is an incredibly varied topic. As you can see, it's such a flexible form of care. So Bob's done an amazing job there, filling a very big topic into 10 or 15 minutes. So hopefully you've really got an idea of how it can be applied in that discharge setting, that hospital discharge setting. Bob is, of course, an expert, but more importantly, Paul is a shared lives carer and has been for the last 10 years. Paul is there on the right with one of the people he supports, Kevin, there on the left. He lives with his wife, Catherine, their dog, Sky, Kevin, and also another person they support through shared lives called Paul. Paul's been working for shared lives, as I say, for over 10 years, but before that, his background wasn't actually in care, but was actually in retail management. But ever since starting as a shared lives carer, he's positively impacted a lot of people, 2 particular people that use the home from hospital service in very different ways, which I'm sure he'll tell you about right away. So Paul, over to you.
Good morning, everyone. Thanks, Carla. Right, yeah. So I'm Paul. I worked in retail for Halfords, the bike shop. I managed a store with a turnover of £3 million a year. I managed 40 to 50 staff. And then in my early 40s, they brought in having to work 3 out of 4 weekends, and I wanted family time. I wanted to be at home a bit more. A parent passed away, and it was a time of change in my life. And I went for a drink. Didn't drink much, but I went out with a friend who, funny enough, was and is a shared lives carer. And I'd known this guy, Jeff, since I was in my late teens. And I knew what he did, but I didn't know exactly what he did. But found out an awful lot about what he did. And I suppose the rest is a little bit of a history, really, because I then, after 27 years of retail, made a life change. Was lucky I was in a position where I could change my life, and not just my life, my wife Kath's life as well. She's got a proper job, and as she calls it, and we went on the road of shared lives. So I think it was between 5 to 6 months. I got myself a part-time job, and in that time did, as Bob mentioned, training and courses, and I did course after course after course. And funny enough, in the last 10 years, I still do course after course after course of anything from, I've recently done DFib training, medication safeguarding, health and safety, fraud awareness, diversity, just renewed my first aid 3-year course. So training just seems to be something that you do every day now. And I know everyone does that in every walk of life, but this training really helps and makes my life easier and safer, supporting the people I support. You can do the little guy next to me, Kevin, suffers from epilepsy. So when Kevin came, I didn't know a great deal about epilepsy. So I signed up for epilepsy courses and did a little bit more. And the first time he had a fit, it just made it a little bit easier of knowing the best way to deal with Kevin or help Kevin and support him. The other guy I look after permanently is Paul, and he suffers from severe anxiety and mental health problems. So I've done numerous courses about mental health and anxiety, and can support and help him a little bit more with understanding. We all have anxiety, and we all have, I'm a bit of anxiety is with me as we speak right now, but it sort of helps him to manage his anxiety. So they're sort of two lads I've got that we have permanently. We've had Paul for 10 years, and we've had Kevin, I think it must be coming up to 6.5 years. So it works. Whatever we do seems to work. But we also, we have, from time to time, we have home from hospital people coming to join our family. And one lad that really sticks in my mind, Van, who came to us, was I don't know, late 40s, similar age to me, I suppose, at the time. Broke his leg, and Van's from Brazil. His English was better than mine, but he had no family in the UK. He worked in the UK, and he broke it. He was on his way to work, cycling to work, and he got knocked off his bike, and he broke his leg in 3 places. They sorted his leg and put him in plaster, but the flat he lived in wasn't suitable for him. So Van had been bed blocking, I suppose you'd say, in hospital for about 2 weeks, 3 weeks, fit enough to be discharged, but still needed that little extra support. So the social worker in the Royal Hospital must have found something that says PSS and home from hospital, and was referred through the process Bob has explained. And he came and stayed for nearly 4 weeks with ourselves, and we were helping him with his appointments and arranging for him to get to hospital and home, and making sure he had his medication and getting to his physio appointments. And it was great having someone that, you know, he taught us how to, some lovely Portuguese food. And we got him FaceTiming to his mum and his dad in Brazil. So he was in communication with his family and his son in Portugal. And, you know, it was nice having him part of the family. And then Van went back home when he was able to manage on his own and get up his 3-story flat and be back. And that was just before COVID. And Van still is in contact with us. And he's just got married, and, you know, he's got a good life, and he's in a good place. So that was Van. And then you mentioned someone else we looked after, who also came from home from hospital, is you saw Kim Johnson talking about a man that was in and out of hospital, had alcoholic problems. Well, that young man is Kevin, and Kevin's been with us for 6.5 years. And in December, Kevin will be have not had a drink in 7 years. He doesn't smoke. He originally came for 3 weeks, and he never went home. But if he had gone home, and had explained before he'd been in and out of hospital, and they'd get his drink problem sorted, and he'd end up having a drink and going back. Well, now Kevin is dry, he doesn't smoke. His sisters were his support. His sisters now are our sisters, and he is living a new chapter in his life where his sisters are his sisters. Bob mentioned also about expert by experience. Kevin is an expert by experience. He gets involved with looking at new carers and seeing, would he like to live or be or respite with those carers? So Kevin is now, as he puts it, giving something back. But it's just to remember is that he came home from hospital, but he lives now. Before he survived, and now he lives, and he's got a life, and he's got a future. And if he was here today, he'd tell you it all. He loves to talk about what he does and his successes. And it's as much as he'll say it's PSS that's his success, actually, it's Kevin. Kevin is his success. It wouldn't happen if it wasn't for Kevin. And I was totting up in the last, 6.5 years, he's had a week in hospital in total, where prior to that, he was in and out of hospital. And the week he did have was a managed appointment, so they knew he was coming in. It wasn't an emergency. So it just gives different avenues that, yes, Kevin is permanently with Shared Lives, but not all avenues need to be permanent. I think that's me.
Brilliant. Thank you so much, Paul. That insight is so good for us to hear. And exactly, thank you, Bob, for, telling us about the practical side of things and how it can actually be applied in that work setting. But to hear that lived experience is really valuable. I hope everybody feels the same way. So as we wrap up, thank you for staying with us until the end. Bob, what can people do if they want to start implementing Shared Lives into their hospital discharge?
Yeah, as it says there, I mean, if you want to know where your local scheme is, because there's independent schemes and there's local authority schemes. So as you see there, Shared Lives Plus, if you go onto that website, you'll be able to identify the Shared Lives scheme in your area. If you want to be able to find out more about Shared Lives, you can there's the option there to follow PSS on that. But you can Google Shared Lives, you'll get a lot of information there. But as I say, home from hospital, and I know that not lots of areas do home from hospital, but if you're working in a region that doesn't, and they want to find out any more information on it, they can always contact me. I'll let them know how it works, that sort of thing. But it does work. We've proved it works. It's lots of, as I say, Kevin's story is very, very powerful. If Paul's just told you briefly some of the things that he's done, but it is a powerful story, and there's lots of powerful stories for Shared Lives people. So if you haven't heard of Shared Lives or you haven't accessed Shared Lives, it is, as we said before, it's been with us since 1978. It's been there for over 40 years. It does provide really positive outcomes for people. I'm really passionate about it, as you can imagine. So as I say, that's if you want to find out more about Shared Lives, but find out your region as well, sharedlivesplus.org.uk.
Thank you very much, Bob, and thank you everyone else for joining us today. Enjoy the rest of Social Work Week.